Alright, today I'm going to be giving IV push and IV piggyback. So I'll start off by checking my orders to my MAR and making sure that my patients match up, and they do. It's the same patient. The date of birth matches, and also my allergies. My patient has no allergies. I'm giving gentamicin 60 milligrams IV piggyback, and I'm giving furosemide 40 milligrams IV piggyback. So all that matches up on my MAR. And then I'm gonna go to my book. It's I'm giving 40 milligrams, so it's a safe dose. The furosemide can be given undiluted, or it may be added to normal saline, lactated ringers, or D5W. I have D5 hanging, so it's compatible. My rate of administration is 1 to 2 minutes, so I'm gonna give it 2 minutes just to be on the safe side. I also need to check blood pressure, keep a check on labs, BUN, creatinine, and it also can cause hypotension, so I need to let my patient know that whenever it makes them start going to the bathroom a lot, that they need to call for help so they don't fall. I'm gonna go ahead and do the gentamicin, and it's a safe dose. It's 3 milligrams per kilogram of body weight, 24 hours, equally divided into 3 doses. It can be given in 50 to 200 milliliters of IV normal saline or D5W. D5W is hanging, so it's compatible. And then it's mixed in normal saline. I'm gonna give it says you can give it over 30 to 60 minutes. I'm gonna do an hour just to be on the safe side. I need to monitor my therapeutic levels, which is between 4 and 8. I need to also make sure that they're excreting that 30 milliliters of urine an hour. I need to keep a check on BUN and creatinine, and I also need to monitor their calcium, magnesium, sodium, and potassium. And I also need to teach my patient that good hydration is needed with this medicine. So after I did all that, I'm going to gather my supplies, and then I'm going to check my expiration date and check my medicine with my MAR, and it matches up. Furosemide, this is actually 100 milligrams. We're going to be given 4 milliliters because I've already previously done my drug problem. So my furosemide, my syringe, my needle, and an alcohol prep, and my label. And I'm gonna wash my hands. Alright, I'm giving 4 ml, so I'm gonna draw up. Check it for air bubbles. Alright, there's 4 milliliters. Alright, I'm going to fill out my label, put my patient's name, the drug, how much I'm giving, when it was prepared, and who it was prepared by, which it was prepared by me. Alright, so there's that. I'm also going to go ahead and do my prime for my piggyback. Go ahead and clamp it. Keep those air bubbles. Alright. I'm keeping the cap on so I don't contaminate. Getting all my air bubbles out. There's one more coming. Alright. And now I'm ready to go to my patient's room. So I would knock on my door. Hey, Mr. Smith, how are you today? My name is Chrissy. I'm your nurse. I'm going to be giving the 2 medicines that your doctor's ordered. He ordered furosemide, and that's going to go, we're going to put it through your IV that's already there so we don't have to start another one. You're also going to be getting gentamicin, 60 milligrams IV piggyback. With the furosemide, it's going to make you go to the bathroom a lot, so whenever you get ready to get up, you need to hit the call bell so we can come and assist you, because if your blood pressure drops, it might cause some dizziness. And the gentamicin, just make sure you have good hydration, and I'm going to be keeping a check on that urine output, okay? Can you tell me your name and date of birth? And I would check the armband, and I would also ask him about allergies. He tells me he doesn't have any allergies. So then, I can go ahead. I'm going to give the push first. So I would drop this and check for patency. I see blood return. There's no edema, no swelling, no infiltration. My push is compatible, so I do not have to clamp it off or anything like that. And get some, wash my hands. And we'll be giving this in the port closest to the patient. Scrub that for 15 to 30 seconds. Let it dry. Also, Mr. Smith, if you feel any burning or tingling or itching while I'm giving you this, please let me know so we can stop it and I can monitor you for adverse effects. I'm pushing this over 2 minutes. So I'm going to clamp it off. I have 4 milliliters, so I'll be doing 2 milliliters a minute. Okay, and then I'll let it flow for the rest of my minute. Alright, it's been a minute, so I'm going to clamp it off again and finish the rest of my Alright. And I'm monitoring for the rest of my minute and just make sure that he doesn't have any adverse effects. So I would dispose of all of this. Alright, Mr. Smith had no complications while I was giving the IV push. I gotta put this on my, and I would do that before I got in the patient's room. So there's my label for that. Alright, I'm gonna go ahead and give the piggyback. So I drop my primary. Alright, it's already primed, so I can just go ahead and it goes into the site closest to the primary. Make sure both of these are open. And they are. I'm going to be giving this over 17 drops a minute. I'll control it with this. So first I'm going to count for 15 seconds, and it's like 4.25, so I'm just going to try to get 5 drops in 15 seconds. It's going to have to be slower than that. I'm gonna have to undo it. It ain't dropping out. Alright, I'm gonna go ahead and count for a full minute. Okay, so that was a little more than 17 drops a minute. So I'm gonna readjust it and then restart now. Okay, so after all that, I would let it go for an hour, and I would continue to monitor Mr. Smith, and then when I come back, let me put this back up. So when I'm coming back in, I'm going to keep the regular going. So I'm just disconnecting this. So I'm going to clamp it off that way I don't lose anything. Take this out. Dispose of that. Lift my primary back up. And then I would re-regulate it by my drops a minute right here. And that's it.